Hi, I'm Chelsea Boyd, and I'm a research fellow at the R Street Institute's Healthier Communities Department. Today we're going to talk about nicotine and mental health. The relationship between smoking and mental health conditions is much more complicated than many people realize. About half of people who smoke will experience a mental health condition in their lifetime. The reverse is also true. People with mental health conditions smoke at higher rates than those without. Let's look at some statistics. In 2019, about 16% of people without a mental health condition smoked during the past month, but about 28% of people with a mental health condition smoked during the past month. Additionally, people with mental health conditions tend to have greater nicotine dependence and smoke more cigarettes than people who do not have these challenges. Furthermore, people with mental health conditions successfully quit at lower rates and return to use at higher rates than people without mental health conditions. This is despite the fact that having a mental health condition does not decrease people's motivation to quit. The impact of higher smoking rates on life expectancy is significant. People who have serious psychological distress and who smoke lose about 15 years of life compared to never smokers without a mental health condition. Compare this to never smokers with serious psychological distress, and they lose about 5 years of life. Why is this? Evidence suggests that people who smoke experience stronger withdrawal symptoms and are less interested in other activities that may provide pleasure while quitting. Beyond that, some studies suggest that people with mental health conditions smoke to self-medicate their symptoms. This could make quitting more difficult. Healthcare providers may also inadvertently discourage people from quitting because they may think that their mental health symptoms are more pressing than quitting smoking. Additionally, because most clinical trials of cessation tools have excluded people with mental health conditions, questions remain about the effectiveness of nicotine replacement therapy and pharmaceutical treatment options for this population. Given the stagnant quit rates for people with mental health conditions, not only should these pharmaceutical tools be studied further, but it's also important that we explore every tool available to us to improve health outcomes among this population. The high nicotine dependence and low quit rates among people with mental health conditions have led some to suggest that the harm reduction potential of reduced risk tobacco products may be particularly beneficial for this population. Products like e-cigarettes allow people to consume nicotine without exposing themselves to the harmful effects of combusted tobacco. While few studies have assessed e-cigarettes' ability to help people with mental health conditions quit or reduce smoking, most that do exist have shown positive or neutral outcomes. One trial compared the effectiveness of e-cigarettes and nicotine replacement therapy for smoking cessation among people with mental health conditions. Their findings showed that the products performed similarly. However, participants who used e-cigarettes rated them as more acceptable and were more compliant with their use than people who used nicotine replacement therapy. Overall, participants who used e-cigarettes decreased the number of combustible cigarettes smoked more than people who used nicotine replacement therapy. Another small study assessed the acceptability of e-cigarettes among people with serious mental illness. This study found that participants who used e-cigarettes were able to decrease the number of combustible cigarettes smoked without increasing nicotine dependence. Participants also found e-cigarettes similarly satisfying and appealing to combustible cigarettes. Since smoking is much more prevalent and quit rates are much lower among people with mental health conditions, we must use all avenues available to help this population quit or reduce their combustible cigarette consumption. Thanks for watching. If you want to learn more about tobacco harm reduction, visit our website at rstreet.org.